My name is Lucinda Kelly and I'm a portrait artist. I've been bedridden basically this past year. Before Ways to Wellness, I've felt really alone.
I was very unfit. I was sitting in the house vegetating. I would go to the little laddie, take him up to the park where I couldn't get there. I was knackered.
As a GP, if you start working in an area of social disadvantage like the West End of Newcastle, you rapidly discover that illness is socially determined. What we want to do is get people to think outside their illness. It might be eating a better diet, taking more exercise, looking at reducing their alcohol intake.
It's about them wanting to change, so if they don't feel that they're being listened to and if their voices are discarded, then sometimes that affects their ability or confidence to go out and access these services.
Working with SIMA, I've felt really supported and listened to for the first time ever, really.
When I came up here, I couldn't hardly do anything for the first couple of times. The exercises you would do to help your breathing, so they help a lot. And the first opportunity I got of somebody trying to get us fit, I took it, I jumped it with both hands.
I think Ways to Wellness is a huge opportunity for people to access a service that's like walking through an open door that can give them support to try all sorts of different things, educate themselves in different ways, get confidence to manage their long-term conditions in a better, more useful way going forward.
We were really excited about Ways to Wellness from day one because we thought it embodied innovation and entrepreneurship. It is really a local answer to a deep local health problem.
My name is Tara Case. I'm the Chief Executive with Ways to Wellness. Ways to Wellness is a service that I don't think would exist if we didn't have social impact bond funding. The NHS, Public Health England, they aren't in a position to start funding things that have risk still. Social impact bond funding gives us the opportunity to scale up what has been done at a pilot level.
A social impact bond is an outcome-based contract between an investor, commissioner and delivery body. In a social impact bond, an investor puts the money up front for a charity or social enterprise to deliver intervention. Big Society Capital invested £10 million into Bridges Ventures to invest in outcome-based contracts delivered by charities and social enterprises.
So we made an investment of 1.65 million to basically fund the setup of Ways to Wellness, and that investment will be repaid over the course of the 7-year program once the outcomes are reached, so once the targets are met by Ways to Wellness.
My name is Guy Pilkington. I'm the Clinical Chair for Newcastle Gateshead Clinical Commissioning Group. As a commissioner, we know that the bulk of our money is already accounted for. We spend our money on healthcare interventions, either from the hospital or from community services, and actually we don't have any money to spare. We want to create a different kind of way of looking after people, and therefore having alternative sources of funding is the only way we felt we could do this.
The outcomes that Ways to Wellness have to achieve to trigger the payment from the commissioners are improved wellbeing, reduced entry into hospitals and reduced length of stay in hospitals, both measured against the control group in Newcastle East.
We are looking to achieve better lives for the patients that this program works with. It's 11,000 patients over 7 years, so it's a significant impact, and that's really exciting.
So getting back to the studio has really lifted my spirits hugely, and it's made me much more hopeful and happy, and it's meant that I've been surrounded by people, which is really important. I think that's one of the best things about Ways to Wellness.